Now, I wanted very shortly to introduce you to the Scottish Alliance for Food. For those of you who are not familiar with the Alliance, this is a Scottish Funding Council project that has been aiming to get everybody talking about food systems and bringing people from different backgrounds with the idea to understand and address the complexity of the food system. We all want to have an improvement in health and diet using a sustainable and equitable approach. So with SCAF, we want to bring together people to discuss, but also to formulate projects based on research that are going to bring a change to our food system. So that's the whole idea behind SCAF. We want to share with you some of the findings of our project Yes to Veg. You see here the agenda for today. Yes to Veg was the beginning of a conversation with Irina Martin from Nourish Scotland, who is behind the development of the project. And this is part of SCAF Theme 4, which deals with food security, community as well. So we aim to develop research projects, bring people together, collaborate to bring solutions to the problem of food insecurity and improving diet within the context of an improved food system. So I'm going to leave you now with Irina. We have a little overview of the Yes to Veg, and then I will come back and talk very briefly about the importance of cross-sectional collaborations from my perspective. And then we will hear from Sabrina what the Yes to Veg found.
Thank you so much for having me today. I think some people may have already heard from me when we were visiting all these nurseries. But for those that are new, so my name is Irina. I work for Nourish Scotland, which is a small charity that focuses on food policy and practice. I just thought it will be helpful to give you a little bit of background how the Yes to Veg nursery project started. This was part of a UK-wide project called Peace, Please. And we had a very simple aim, which was making it easier for everybody to eat more vegetables. So we worked with pledgers across the whole UK that committed themselves to make changes so vegetables became more accessible for people. At the same time, we recruited veg advocates. We had over 46 in Scotland that were people that really passionate about vegetables, people that were really aware of the barriers that people had in order to access vegetables in their communities. So we worked, pledgers and veg advocates worked together throughout the 3 years of the project to kind of work together to see how things could improve. And at the end of the project, veg advocates were able to receive a bit of funding to run an activity in their communities based on what we learned throughout the 3-year project. So one of the veg advocates was a kitchen assistant who was very passionate about veg. And when we were designing the sessions, she came to us and she said, I make sure that children in the nursery have veg at break times, at lunch times. I volunteer to run workshops, cookery workshops for parents, teachers, children. And unfortunately, I am the one that throws the vegetables in the bin because kids are not eating them. So she wanted to do she approached us because she thought we needed to do something different. We needed to think outside the box. So we kind of went straight to science. We wanted to we did a little bit of research. And what we learned is that toddlers' palates are a lot more sensitive than primary school children. So it's a great age to explore new flavors. We learned that children respond really well to repetition. So if they do something from 8 to 16 times, they get it. We learned that children like to touch food with their own hands and they don't like things to be mixed up. And as you all know, children learn best by playing. We also talked to teachers, and they recommended to us to kind of think about sensory learning because that allows children to learn by using their senses like taste, hearing, sight, smell, and touch. And of course, Nourish Scotland has a food system approach. So based on that and the aim of making it easier for children under 5 to eat and enjoy vegetables in a fun and interactive way, we wanted to improve children's food environment. We wanted to make vegetables more accessible to children. And we wanted, most importantly, we wanted children to take an active role in the whole process. So how can we make children how can we give children that agency within their own food environment? So we kind of like developed these 6 principles that we encourage nurseries to do. The first one was to link the nurseries with a local organic supplier that will deliver 2 types of vegetables each week, and that reinforces that repetition that we talked about. We wanted to make vegetables a routine and normal part of the children's surroundings. So the vegetables were like everywhere, in the drawing corner, in the singing corner, so kids could just help themselves to those vegetables whenever they wanted to. We didn't want to give more work to the teachers. They already have a very busy schedule. So we just wanted to embed vegetables in activities that are already happening at the nursery. So if they're doing math sessions, singing lesson sessions, veg would be like, part of those activities. As I said before, we wanted to empower children to take an active role in their food environment. So that could be by welcoming the veg, taking the veg to the kitchen, washing the veg, serving their peers the vegetables, helping the teacher to display the vegetables across the nursery, just having like that agency. And also we wanted to take that learning back home. So we encourage parents to take the same vegetable home, so the kids could kind of like share with their parents what they were learning at nursery. Since then, I think over 30 nurseries have taken part in this activity, and it just seems like we've been having really good feedback. That just like, I hope, providing this kind of like background of how we develop the activity helps people connect to understand the thinking and how important it is to work with people that are working with children themselves, and they're looking at those barriers. And I hope that was helpful.
Yes, yeah. So there was a piloting phase of the Yes to Veg, which I think is quite important for the context of what happened after. So that was when we, as Glasgow University, came to be part of this project. Aina and I spoke about it, and we developed a program of evaluation, which is what Sabrina is going to share with you after. I just wanted to bring you a little bit of context about the cross-sectoral collaborations that, for my experience as a researcher here at Glasgow University, have been extremely fruitful and useful. And I think from my learnings, we really I have come up across with some really important findings in terms of not just the research, but also the way that one can develop collaborations with the third sector or with NHS, with the government here in Scotland. So I've got this slide here to show you. So the very first person that I met when I came to work in Glasgow was Ian Shanklin, who worked for Lanarkshire Community Food and Health Partnership. Maybe some of you are familiar with his work. And back in 2015, we shared together a third sector forum where we were thinking about what really brings for us to collaborate. And it was very clear that we can benefit from different skills, from different resources, from the capacity that each sector can bring together, and from the new ideas and innovation that our working together can bring. So that is just, for me, it's a win-win situation. So as a result, I've had some really amazing projects that we have been developing together with our partners. We work together. So there are some examples here. We can see we have done a lot of work looking at cooking, at nursery-based interventions, using the context of people delivering these interventions. So those of you who work trying to improve the food landscape, to reduce diet inequalities, if we bring our expertise together, we can really come up with some evidence-based so findings, evaluations that can be very useful for funding, but also for delivering programs at community level. So what's, for me, how do we come up and work together? So there are certain things that are really straightforward to do. And SCAF is a platform now that is here for you to link with academia, with other sectors, with different people. So if you want to find out more, we're going to leave the SCAF so information where you can have access to what we do. So we find common ground. My positive experience have been doing small things, so small pilots, small studies that can then be expanded for something bigger. We set out very clear expectations about what each of the sectors and parties is wanting and what our timelines are. So within academia, we have to be very clear. It takes a bit of a longer process considering ethics and also what the expectations around funding are. So just to bring this experience I've had in the past, so I think it's really very useful. And here we are to try and bring people together. And we have now the platform of SCAF for that. So with that, I'm going to pass the next bit of our webinar to the findings of the Yes to Veg, which is going to be done by Sabrina, who was doing her master's degree with us here at Glasgow University. Now she's back in Denver, in Colorado. So she's got up early in the morning to come and do this for us. Thanks, Sabrina.
Thank you. Hello, everyone. Thank you for coming today. I will be discussing or sharing the results with you of the evaluation of Yes to Veg, which was a quasi-experimental study on vegetable consumption in preschool-age children. So to clarify, a quasi-experimental study consists of both an intervention group and a control group, yet neither of these groups were assigned at random. So that is just how the study was designed. So in the 2022-2023 school year, a quarter of the P1 children were considered to be overweight or obese, with also only a quarter of the children meeting their fruit and vegetable consumption recommendations. It is also important to note that children living in socioeconomically deprived households are at higher risk for being overweight or obese and not meeting their fruit and vegetable consumption recommendations. Down below, there is a graph that depicts this. We can see that children between the ages of 2 and 15 living in the most deprived households are more likely to be obese than those living in the least deprived households. We can also see that those living in the most deprived households are less likely to consume any vegetables, not including salad, compared to those living in the least deprived households. There are many health implications with vegetable intake. A variety of fruit and vegetable intake relates to micronutrients being consumed, vitamins and fiber, which help consume or maintain a healthy gut, an improved immune response, and reduce the risk of being overweight or obese. Bitter vegetables are a great source of vitamins A, C, and K, iron, polyphenols, and then minerals and fiber. Childhood nutrition has an implication of health in adulthood. In a 2021 systematic review on childhood obesity, it found that childhood obesity can be linked to health complications such as type 2 diabetes, cardiovascular disease, and other issues in adulthood. This is important to address in childhood, so interventions such as Yes to Veg that help address vegetable consumption and healthy balanced diets are important. The government does have vegetable consumption recommendations set forth for the early years. Setting the Table, a nursery guide specific for nursery schools, recommends that 40 grams of fruit and vegetables be consumed at every single meal. An overall increase in vegetable intake specifically for children, and this focuses on vegetables because children are more likely to consume fruit than they are vegetables. And it is important to develop their food preferences at a young age, as this is a very important time in their learning and development patterns. This is recommended to get children to try a new food or vegetable up to 10 times to get this exposure. And it is important to note that children are fussy eaters in toddlerhoods, and interventions are definitely needed to help address some of these issues. The aim of the evaluation or of the study was to look at vegetable exposure and agency in preschool age children, as well as vegetable consumption in preschool age children. We received our ethics and started recruitment at the end of April. In this, we recruited 11 different nurseries. We went to 11 different nurseries and delivered 775 total participant information packets to these nurseries. After this, we collected a total of 256 consent forms back. The intervention ran through the duration of May. We collected pre-questionnaires back during the first 2 weeks of the intervention, and we received back a total of 168 pre-questionnaires. During week 3 of the intervention, I personally went to the nurseries and conducted observations at all nurseries, both the intervention and the control ones. These lasted roughly an hour. During week 4, we delivered the post-questionnaires to the nurseries to be handed out to parents. During the first 2 weeks in June, we collected back these post-questionnaires, and we received a total of 57 paired questionnaires back to be able to conduct analysis on. Data analysis happened from June through to August. Yes to Veg is the intervention. It ran over the duration of 4 weeks, so that entire month of May. Locavore, a local organization, was in charge of delivering fresh and organic vegetables to the nurseries once a week. They delivered a vegetable that children were less familiar with, as well as a vegetable children were going to be more familiar with. The intervention had children have access to these vegetables throughout their playroom so that they can engage whenever they wanted, as well as gave the nursery staff the independence to decide what activities they ran. This could be a variety of things from painting, cooking activities, having it out so they can have imaginative play, or weight and measuring. So the nurseries got to decide what happened with those vegetables once they were in the room. Parents were also encouraged to take these same vegetables that were delivered by Locavore back to their homes so that children were also getting exposure in the home as well with these vegetables. The intervention targeted sensory play through smell, touch, taste, and sight. Repetitive play for them having the same 2 vegetables throughout the duration of the week at nursery. Their palate and agency. Like previously stated, children had the ability to engage with the vegetables however and whenever they wanted. So the freedom to pick it up, walk around with it, and engage with it, play with it, all sorts of things. The vegetables delivered, there was 8. We had cucumbers and tomatoes given to the nurseries during the first week, radish and spinach during week 2, carrots and courgette for week 3, and lettuce and mushrooms for the final delivery during the 4th week of the intervention. Here are some photos of the children engaging with their senses and the vegetables throughout the observations that I conducted. You have some imaginative play, some more imaginative play, but with food that has been prepared, cut, grated, or however the nurseries were having them engage with these activities. For our control group, we recruited 5 different nurseries. We had 4 remaining at the end of the study. No intervention was given to these control group nurseries. However, they did receive the Eat Well guide, which is put out by the government in their recruitment packets. These nurseries are on a waiting list to receive the Yes to Veg intervention upon more funding. We collected both quantitative and qualitative measurements. So for our quantitative measurements, we gave parents pre and post questionnaires. These questionnaires asked the same questions before and after. Some of the information that we collected was on sociodemographics, such as sex, age, their postal code, their learning needs, language, the age of the guardian, and their relationship to the child. We also looked at exposure. For this, we had a list of 27 vegetables on this questionnaire. Both the parent was supposed to indicate whether they and their child had tried a vegetable on this list prior to the intervention, and then as well as after the intervention. For consumption, we looked at frequency of vegetable consumption and variety of vegetable consumption. These are measured on a sliding scale. For frequency, our scale looked like, do they consume it most days, every day, once a week, or never? And variety looked like, are we consuming any vegetables, 1 to 4 different kinds of vegetables, 5 to 9 kinds of vegetables, or 10 or more? For agency, these were reported by the parents, so whether or not their child was engaged with vegetables or actively working with it or trying them at the home environment. For our qualitative measurements, we worked with nursery staff. We had given them questionnaires and forms to hand back to us. This was questions that asked information regarding on what kind of activities they had ran prior to the intervention with vegetables, if any at all, and then again what they did after the intervention had been integrated, and anything else they might have added that was information about the nursery and how they worked with the vegetables. I also conducted interviews with the nursery staff members during week 3 when I went in to do observations. My questions looked at engagement, the ability to integrate the intervention into the nursery setting, as well as activities and the reception of the intervention from the nursery staff. Like previously stated, I also conducted observations, so we have some notes from that as well. 86% of our participants lived in deprived neighborhoods in Glasgow, 65% in the most deprived areas, and 21% in areas just considered deprived. Most of our work happened in Drumchapel, Shettleston, and then the Pollock areas of Glasgow. The age range of our participants was from 35 to 67 months, whilst 50% of our population in both our intervention and our control groups were comprised of boys. We had a total of 34 pre and post paired measurements returned from our intervention group and 23 paired measurements for pre and post questionnaires returned from our control group, bringing our total study population to a total of 57. Going back to exposure and that vegetables tried list, from the 8 vegetables that were delivered, 7 were listed on that list on that questionnaire. Courgettes, spinach, and mushrooms saw an increase in children who had tried them after the intervention as compared to before. We can see with the red ring that we see a visible number of people saying more children had tried it after the intervention than at the start. No change was detected in our control group. For a variety of vegetable consumption in children, we can see that those reporting consuming 10 or more different types of vegetables increased in our intervention group from 18 to 21%. No change was really detected in the variety of consumption in our control group. When understanding the frequency of vegetable consumption in children, when looking at our intervention group, we can see that both the categories for everyday and most day consumption increased. In our everyday category, we had seen an increase from 15 to 21% reporting they were consuming vegetables every day, and then from 41 to 47 in those reporting most days that they were consuming vegetables. This underwent further statistical analysis via Wilcoxon test, and it was the only one proved to be statistically significant. Our control group also saw an increase in reporting everyday consumption of vegetables. This went up from 13 to 22%, and it decreased for their most days from 48 down to 43. There was no statistical analysis found with this. When looking at vegetable exposure and engagement as reported by the parents, we asked questions on the questionnaire about whether or not they felt their child had tried new vegetables or whether or not their child was discussing vegetables. As we can see, in the intervention group, we had 41% of parents reporting that their child had tried new vegetables, compared to our control group, which only had 34 parents reporting that their child had tried new vegetables. We can see with the discussion of new vegetables that parents in the intervention group, we had 91% responding that their child was engaging in discussion or talk and engagement around new vegetables, with only 65% reporting this in our control group. Looking at our qualitative analysis in both our parents and our nursery staff, we were looking at 3 main themes. Our first theme was engagement with the intervention, both at home and in the nursery setting. Our second theme we were looking at was the sensory engagement, so going back to that touch, taste, smell, sight, and play. Our third theme we were looking for was the acceptance of the Yes to Veg program. Were parents and nursery staff feeling positively about it, or were they having negative responses, or were they feeling neutral about the intervention? For theme 1, engagement with the intervention, we had nursery staff saying that children were talking about vegetables more. We also had another nursery mention that the children may not like the vegetable, but they're at least willing to try it. We had a parent reporting that their child was really excited and happy to tell them about the new veg. We had another parent reporting that their child was now asking for vegetables with the meal, which just had never been the case before, and they had to use bribery in the past to get her to try vegetables. For sensory engagement, we had positive responses. We had parents saying that their child was now wanting to try vegetables raw instead of cooked. We had another parent report that their child was now more interested in the cooking process, with another parent giving a neutral response saying, in some ways, yes, and in some ways, no. He hasn't tried any new vegetables, but has really enjoyed the chopping and the touching and the food preparation process. And it's been good for him to get more aware of the different kinds of vegetables through this process. And they wanted to continue to engage in him in the food preparation process and hope that someday he would try new vegetables. So we can see some really positive comments through there. For the acceptance of the program, we had parents reporting that it was great to encourage good eating habits at the nursery as well as in the home setting. We had another parent tell us that it was a good initiative and they support the idea of children having access to different vegetables during their meal times. Through my observations, I got to see staff come to me really excited to share stories about how the children were interacting with the vegetables and engaged with the intervention. A story that sticks out is how nursery staff were telling me that they had a child that didn't typically engage with meal times at the nursery, were asking for someone to eat or play or hold some of the vegetables that were delivered that week to the nursery, and then asked for more. Another observation that I had was that the preparation or the cutting activities, which were guided by staff, was among the most common and most popular for nurseries and for the children to engage in. I also noted that the outside mud kitchens and play areas did not have the same level of engagement with vegetable play as compared to the indoor spaces. The study had some strengths and limitations. One of our strengths was that we recruited in an area that was hard to reach. And another strength is that our study included a control group. Some of our limitations included our small sample size. Remember that our final total study population was 57 people. Parental engagement with the evaluation was limited due to the time of year. So this evaluation part, collecting back some of the post questionnaires, happened at the end of May, and then we were collecting some of them into June. So this is the end of the school year, so life gets a little more hectic around that time. The duration of the study was also super short. We had a 4-week intervention, so that's another limitation of our study. To conclude, we saw that Yes to Veg increased children's willingness to try new vegetables, as well as we saw that Yes to Veg increased their exposure, their engagement, and their familiarization with vegetables and the promotion of agency. Yes to Veg was found to be well received by staff, children, and parents within the community. We would like to thank everyone who made this possible: Siobhan Boyle with the NHS Health Improvement Team, Irina Martin at Nourish Scotland, and Local 4 for the food deliveries, as well as all of the staff who welcomed us into their nurseries to be able to conduct the evaluation, and those who ran it. Thank you.